As the Neet super specialty results are out and counselings are about to start, many students are having doubt with respect to institute selection. The topic of discussion today is related to that. A short outline. So in the background, you might see when I gave the super specialty rank, my rank was 15, and how I prioritized it. That also I will discuss. So see this video fully so that you will get a fair idea. Because the discussion is going to related to all things which a student have to consider before putting the college order. Let's start. First thing and the most important is the bond. After super specialty, there are institutes which implement bond. You are bound to do that. There are certain institutes which put bond for 2 years. So post DM you can't go out unless you pay the bond money or unless you complete that bond period. Here a info I want to say, in a particular college, they might say, sir, it is only for documentation. We might not, the institute might not follow it because your seniors or someone in the institute might be saying. That doesn't matter. It will depend on what you are signing in that legal document. A good example is a famous institute in Uttar Pradesh where there was no bond, even though legally they got the sign before 2022. But in 2022 batch, the 2019 to 2022 batch, they put or implemented bond of 2 years. Previously, the bond might not be followed, but it might be the batch might be your batch will be which will be following the bond. So be careful, decide how many years bond. If they have implemented, what are your options, consider that in the college selection. Try to take in a place where there is no bond, preferably Delhi type of places where DM nephrology is available in 2 institutes, RML and Safdarjung. There is no bond. That is the first priority. Second one is stipend. Because at this phase of life where most of them might be around 25 to 35 range age group, many of them might be the sole breadwinner for that family. So stipend is an important consideration at this point. If they are financially good or sound, yes, you can consider other academic things compared to this one. But for many students, this might be a big deciding factor where you have to take care of your expenses, your family expenses for the next 3 years. Yes, teaching can be there, but along with that, you need this aspect also. So, stipend is the next priority. These are the two non-academic related stuff you have to keep in a important weightage you have to give in the college selection. Now coming to the DM nephro per se itself, what are the things you have to prioritize? Take in a center where there is an ongoing transplant program, where there is a good number of transplant is occurring. Even the numbers are not so high, at least if the transplant is running, you will get to know about pre-transplant care, how to manage on the transplant day, and post-transplant complication. You can get the good exposure during your residency. So a college with a running transplant program is always better than a college without the running transplant program. Few students might be having doubts, sir, my rank is not that good, I will get. See, I am letting the things priority one by one. At the end, I will let you know how to prioritize the things if the rank is not good. Coming to the fourth one, free hand for intervention. Because if you take DM nephrology, it is all about the interventions like biopsy, transplant kidney biopsy, peritoneal dialysis catheter insertion, acute PD, chronic PD, permacath, AV fistula. You have to ask the particular seniors in your institute which you are planning to take how free hand the residents are getting, because post DM You might have to handle the hospital independently, hospital in the sense nephro department per se. So you have to be confident enough to manage those. For that, a interventional nephrology exposure during your nephrology residency is very important. So the fourth one you have to consider is the intervention free hand, how much you are getting during your residency. After this comes the other things like number of theses, how much workload, like what is the number of cases, dialysis machine, how many number. These are all the things which come in the least priority. And one question a student asked was, sir, CRRT machine, number of plasmapheresis. See, CRRT, number of plasmapheresis is not going to be the deciding factor in the college selection, because those are small things. Anyhow, you will learn. And CRRT, even if that particular department is not having, anyhow, you will learn subsequently. So this CRRT, number of a student was concerned about number of plasmapheresis. Number of plasmapheresis is not going to have any impact on your DM curriculum. You see 3, 4 good number, you will get the adequate exposure. Yeah, center where transplant is already happening, plasmapheresis will be happening, so you will get to know the things. So these are all the important parameter you have to look into. And the last one is the some students, they will be more free when they were jumping from UG to postgraduate, that is MD and MS. Whereas right now they will be having lot of personal commitment also, like staying with the family, their spouse might be staying in a particular hospital, they want to stay in a particular city only, they don't want to come out of the state. There are many doctors or students might be in this situation. So a top college of the particular state, for example Tamil Nadu Madras Medical College, Stanley, in a particular state, the topmost college will always have a good or better department. You always can choose that if you are having some geographical restriction where you doesn't want to come out because of the personal commitments. And some students might, or some doctors might be wanting to continue their practice post DM in the particular city. So whatever the stipend may be, whatever the bond period may be, it might not going to affect them. So these are the things they, as a whole, you have to take into consideration. And one more point with respect to the bond is, ask from your seniors if the bond period is implemented where you will be posted, because there are colleagues and my junior, few of them completed DM nephron, they got posted as casualty medical officer in real time last 1.5 years back. So these are all the info you have to keep in a check. Make sure you are knowing before selecting the college. Don't go randomly and get into this kind of trap, because DM, if not, subsequently exams will be coming, INICET is coming, getting a DM is not that difficult nowadays. So don't be in a hurry, don't be in a trap without knowing all these facts. Then coming to my rank and my college selection preference. It was almost half a decade back, that is 2019. When my rank was 15, my priority was again the bond, and this good stipend was my priority. First option I put was RML, New Delhi, because in Delhi that was the only institute where DM Nephro was available during that time. And one extra advantage, I did MD from there only, so that was my first option. Transplant is there, good stipend, no bond, intervention, you will get free hand in RML. So all parameters was there. So during that time, that was my first preference. Second preference was BHU Varanasi. I didn't put SGPGA because there was a bond during that time. Subsequently, I put a top state medical college in Kerala. Only 3 I have put, because the rank was 15 and a few of the rankers who are above me were my friends. So I know their college preference. So I was sure, since there were 4 seats in RML, I was sure I most likely get it. So that was my college selection and how I preferred that one. Here comes the query of the student. See, the priorities I have discussed. Apart from few uh, students who got a very good rank, many of the priority might not match. For example, a DM without bond, transplant might not be there. Transplant might be there, but 2 years bond might be there. These kind of combination you will get as the rank goes little bit towards 20, 30, 40, 50, especially with only exclusively discussing to nephro. So that you have to prioritize what is your personal preference, where you want to stay, how much stipend you can like comfortably move through, how much amount of work exposure you can handle, whether post DM you want to work in a place where there's a transplant or not. These are all things you have to prioritize, because a rank which is in the medium range to average zone, you have to take all this into consideration and put the colleges. So this is an outline, because many of them messaging the particular rank or tell me the institute or DNB versus DM, this kind of question comes. This is outline. You can, as your personal preference, which one to leave, which one to select, that you can decide upon. Okay. And there is already video we have shooted regarding DM versus DNB nephro, that will be uploaded soon, that you can go through for DNB or DM nephro kind of question if you want some outline, that we have uploaded. And these kind of discussion made exclusively for DM nephrology resident students. With respect to DNB nephrology, the corporate culture you will learn, that is one advantage. At least for this video per se, we will stop here. The outline is done. So prioritize bond, stipend, transplant, free hand-in intervention, and workload thesis under the least things, and personal preference, geographical location where you want. These are things you have to consider before selecting the college. Bye bye. We'll see in the next video.